Hi guys, welcome to Pills and Things, where today we will be talking about Trulicity, Ozempic, and Rybelsus for type 2 diabetes. In this video, I will go over how these medications work and then discuss some of their main pros and cons. If you watch my previous video on Victoza, this video may be repetitive for you as these medications work very similar to Victoza. So let's dive right in with how do they work. Trulicity, also known as Dulaglutide, Ozempic, also known as Semaglutide, and Rybelsus, which is also Semaglutide but an oral version, are all in the GLP-1 agonist drug class, and they work in three main ways. The first way is by increasing how much insulin your pancreas releases if your blood sugar is high. If you watch my previous video on diabetes, remember that your pancreas releases insulin to lower blood sugar. What's nice here is that these medications only increase insulin release if your blood sugar is already high. So there's a low risk of low blood sugar episodes, which is something we worry about with other diabetes medications. The second way Trulicity, Ozempic, and Rybelsus lower blood sugar is by decreasing how much sugar your liver dumps into your bloodstream if your blood sugar is already high. And the third way they work is by slowing down how quickly food leaves the stomach, thus slowing down the rate at which sugar gets absorbed into your body. This may also help you feel full faster, which can make you eat less and potentially help you lose weight. Remember, weight loss also helps you lower your blood sugar. All right, so what are the pros of Trulicity, Ozempic, and Rybelsus? The first pro is that these medications lower A1C. Remember, A1C is a measure of blood sugar, and a high A1C can increase your risk of heart attacks, strokes, kidney damage, and eye damage, among other things. So bringing the blood sugar down is important to prevent long-term damage to your body and or death. Depending on the dose, Trulicity lowers A1C by about 1.5 to 1.8%. Ozempic lowers A1C by roughly 1.3 to 1.8%, and Rybelsus lowers A1C by roughly 1%. The second good thing is that Trulicity, Ozempic, and Rybelsus can also help with weight loss, which was about 5 to 10 pounds on average for Trulicity, about 9 to potentially up to 14 pounds for Ozempic, and about 5 pounds for Rybelsus. And just as a fun fact, there's another medication called Wegovy that is basically just a higher dose of Ozempic and used specifically for weight loss with more significant weight loss than Ozempic. The third benefit is that Trulicity and Ozempic have some proven heart disease prevention benefits, which is a pretty big deal for diabetes medications. Rybelsus, on the other hand, does not have this kind of data. The fourth on this list is specific to Rybelsus, which is the first and only oral pill in this drug class. This is nice for people that hate injections. And just for some background, Rybelsus has the same active drug ingredient as Ozempic, which I mentioned previously. Generally speaking, all other medications aside from Rybelsus in the GLP-1 agonist drug class are injections because they have terrible absorption if taken by mouth due to the acidity in the stomach and other factors. But the Rybelsus pill was specially formulated to improve absorption when taken orally, which is a pretty huge breakthrough. That being said, Rybelsus has some pretty restrictive rules on how it needs to be taken. The last couple pros I would mention here for Ozempic and Trulicity are that there is no mixing needed and they can be injected without regard to meals, unlike some other medications in this drug class. As far as the cons, I will mention the ones that I thought were the most important, but this is not an all-inclusive list. The first con for Trulicity, Ozempic, and Rybelsus is the cost. There is no generic available for these medications, so it can be expensive depending on your insurance, if you have insurance. One good thing here is for Trulicity and Ozempic is that they don't need another prescription for pen needles, which is an added cost for other medications in this drug class. Trulicity has a built-in needle, and Ozempic comes with its own pen needles. Number two, some of the most common side effects of these medications are nausea and vomiting. As I mentioned before, these medications slow down how fast your stomach empties. If your stomach is full and you continue eating, you will feel nauseous and want to vomit. The nausea and vomiting side effects are why you are started on a low dose and then the dose is increased slowly over time. The main takeaway here is don't overeat while on these medications. Number 3, Ozempic and Trulicity are injections, which is something to note if you hate needles. That being said, they are only injected once per week as opposed to a daily injection like Victoza. Also, the needle is not visible with Trulicity specifically. Regarding storage, Trulicity and Ozempic must be refrigerated until first use, which can be a con, but then Trulicity is good at room temperature for 14 days and Ozempic is good for 56 days. Rybelsus is stored at room temperature, but it must be stored in the original blister packs. Number 5, these medications can theoretically make a condition called gastroparesis worse as they slow down the emptying of the stomach, so this is something to note if you have gastroparesis. As far as some rare but important side effects to note, there is risk for temporary kidney damage with these medications. It sounds scary, but this is usually related to the nausea and vomiting. If you're vomiting, you can lose a lot of water and easily get dehydrated, which can hurt your kidneys. So make sure to stay hydrated if you're vomiting with these medications. There is also a potential risk for pancreatitis. This is rare, but these medications are not recommended if you have a history of pancreatitis. Trulicity, Ozempic, and Rybelsus can all potentially increase the risk of complications for an eye disease called diabetes retinopathy. Monitoring for changes in vision is important, especially if you already have diabetic retinopathy. Lastly, you will see a giant warning on these medications regarding thyroid tumors in rats. This study was in rats, and it is unknown whether this happens in humans, but if you or a family member had thyroid cancer, then these medications would not be recommended for you. Before I finish, I just wanted to make a little disclaimer. This video is for educational use only. This video is accurate to the best of my knowledge as of the date posted, but data is always changing, so always consult your doctor and pharmacist regarding your medications and what would be best to do in your specific situation. So that's it for today. If you learned something or found value from this video, hit that like button. If you want more easy to understand content on health and medicine, make sure to subscribe to the channel. Thank you for your time and stay healthy. See you next time.